My name is Chris Adamson. I work for Equine Sports Therapy, and we do therapy work on the cutting horses, follow the cutting horse circuit. When a horse is going to show that day, we bring them into our stall and we try to assess what's wrong with them so we can help them show a little bit better and deal with their pain. So to assess them, we check their acupressure points, see where maybe they have a little extra soreness so we can concentrate on that area. This horse feels pretty good. She just has a little back and a little hamstrings. So we're going to hook her up to a microcurrent machine and also do a little DMS work on her, which is deep muscle stimulator, to help flush out the lactic acid, make her a little more soft and supple when she shows. Okay, now we have the microcurrent machine hooked up, and we run this to their suspensories and their hocks, to their ligaments. Ligaments don't get a lot of blood flow, so this machine is increasing the blood flow to those areas, helping with any micro tears they may have in it, any inflammation, stuff like that. It helps get rid of the lactic acid and increases blood flow. This is a DMS machine, the deep muscle stimulator. When our hamstrings are a little slow, we're going to massage her hamstrings, help flush out that lactic acid, make her a little softer in there. You can see she really likes it. She's lifting her tail, so you can get right in there for that. You can feel the vibration of the muscle going all the way through her hamstring group. This also relaxes them if they have a few hours before they show. A lot of times they'll lay down and sleep, really let that therapy go to work before they have to get up and work really hard. Try to work with the muscle fibers at first, and then we'll go cross fibers. It's like a good massage therapist would do on a person. This is really good to use on their dense muscle areas. You can really get in there pretty deep. You can see where that's kind of tight going down into her. So you want to work that really light at first, and then after it softens up, you can get in a little deeper. Get that lactic acid out. And you're going to go with fibers first, and then after you loosen it up, you can go cross fibers, muscle fibers. This other machine that we use, the abbreviation for it is PEMF. It's Pulsating Electromagnetic Field Therapy. And what it is, it has a magnetic field energy inside this hoop. And we can use this on their back, on their sacrum, stifles, some of the hard to reach places that you can't use the other ones. The hoop bends, and if you can see, it's moving her back. It's really flushing out that lactic acid, sending energy in there, dilating those blood vessels to get increased blood flow to any area that's sore. We can move this to any area that's sore. Like if she had a suspensory, we have a different attachment, so we could just concentrate on that area and really increase the energy to just one specific area. Or we can generalize it, use it all over her back. Horses that they get out in their neck a lot of times from their head movements chasing a cow. You can also use it on their neck. And sometimes these horses need to see chiropractors too, and so this will really loosen it up, the muscles up for the chiropractor to adjust it, or afterwards, after he's adjusted it, to make sure they stay in place. After we finish the treatment, we also use liniment to help with those sore muscles. This works into there where we've opened up the blood vessels and dilated them. This absorbs into their skin really nice. Helps with the pain. So we always like to put that on wherever they're sore. And then to finish up the treatment, after you've had that current run everywhere, it's always good to stretch for horses, just as it is with people. So we flex them. This is also a good way to tell sometimes if their neck's out, they won't be able to flex properly. You can tell this is the part of the treatment that the horses always look forward to. Using up all your good cookies. If you notice your horse favoring one leg, not stopping the way he usually does, contact your local vet for a recommendation for therapy work. You'd like to keep your horse working at his optimal level.